All right, we're going to move on to our next section, which are retractors. Retractors are near and dear to every medical student's heart. It is one of the primary tools you will use in most surgeries that you have an opportunity to scrub on. So very important to know and understand the names of these retractors and, generally speaking, what they're used for. Now remember, our discussion today is not going to be inclusive of every utilization. Important to understand the principle, understand what they're called, and generally what they're used for, and you'll be able to apply the principle of their utilization accordingly. So first one we'll use, the first one we'll demonstrate is an instrument called a Wheatlander retractor. So and again, this is one of those classic ones where people frequently call it a Wheatlander, like wheat and lander. That's what I called it for a very long time, until I read a book that this was named after a German surgeon, Wheatlander, and it's pronounced Wheatlander. How you choose to pronounce it and how it gets pronounced at your hospital, just make sure that you get what you're asking for. Important parts of a Wheatlander retractor is that it is a self-retaining retractor. Self-retaining retractor means that you can apply the retractor and it's going to hold the tissues open. Two Wheatlander retractors applied in opposition essentially keep your incision open such that the superficial tissues can be retracted. These are commonly used during hernia operation or open hernia repairs. May be used for breast biopsies, frequently used with neck surgery, all of which are used for holding wounds open and maintaining that self-retaining retraction, allowing hands to be free to operate. Importantly is that the Wheatlander retractor come in two variations. So both of these instruments, unfortunately, are blunt. You'll notice that these tips have a blunt surface to them. Wheatlander retractors can either be blunt or they can be sharp. So very important when you're first handling a Wheatlander retractor is know whether it's a blunt or sharp retractor, and then be very careful about handling it and your gloves and your fingers, because a sharp Wheatlander retractor will tear your gloves and or potentially tear your skin if you handle it incorrectly. It is essentially a sharp instrument, so be very careful with Wheatlander retractors. Knowing how to use a Wheatlander retractor and how to as you progress in your surgical training, it becomes a very important tool as you're operating by yourself. There's no attending across the table from you. You have to set up and establish your own retraction with a scrub tech. How you learn and master the use of your self-retaining retractors is important. There is a variation on this theme, not part of our set, frequently used in orthopedics, but it's called a Gelpi retractor. A Gelpi retractor has a single sharp spike on the end, same type of construct, but very sharp, and that will absolutely penetrate through your finger if you apply it incorrectly. But can also be used in the same manner of a self-retaining retractor and folding incisions open. So once again, Wheatlander retractor come in both sharp and dull variants. The next instrument, or the next retractor, since we were talking about superficial retractor, is a Volkmann rake, or a rake retractor. Volkmann is the eponym. This comes in both a sharp and dull variety. This one happens to be sharp, and I won't demonstrate just how sharp it is, but these are pretty darn sharp. These will easily tear through a drape. And generally speaking, rake retractors are used for subcutaneous tissue, subcutaneous retraction. Frequently used, and I'm a Marvel comic fan, but they can be used Wolverine style, and you can pull on tissues and lift for the purposes of elevating flaps. So frequently rakes are used for exactly that purpose: traction, counter traction, elevating broad surfaces, and used for elevating flaps for mastectomies, for paniculectomies, or other large flap-based procedures. So Volkmann rakes. Once again, safety is important. Be aware that most of the time Volkmann rakes are sharp, and they can tear through your gloves, they can injure a patient or injure structures. So be very wary of where you apply the Volkmann rake. The next set of retractors that we'll come to as we continue our superficial retractors are vein retractors, appropriately named, designed for retracting veins, but they can be used in multiple settings as well. In the era of laparoscopic surgery, vein retractors can be used for retraction of port sites, so to expose bleeding from port sites. They can also be used in a trauma setting, for example, if in a patient with severe facial trauma who you need to examine their pupils. These work very well as eyelid retractors to facilitate pupillary exam. So you can use vein retractors in more than just what they're called for, which is retracting blood vessels. Vein retractors are generally very helpful. They also have good uses in pediatric surgery. They essentially become subcutaneous retractor, or even in some, they can even serve as body wall retractors in some neonatal surgery as well. So vein retractors, again, a very useful and versatile retractor. The next retractor, and of course, certainly from a military perspective, we have a long-standing inter-service tradition and competition as to the Army-Navy retractor. So the Army-Navy retractor, generally used for superficial retractions. Again, it can be used for port sites, it can be used for breast biopsies, it can be used for hernias, but essentially gives you one long end and gives you one short end for retraction. The question is, which one is the long end, the Army end, or which one is the long end, the Army side or the Navy side? Personally, the long end is always the Army side, and we'll leave it at that for our discussion. But essentially, the Army-Navy retractor is used for generally superficial retraction, though the long end can give you some deeper retraction, periumbilical incisions, and the like. So Army-Navy retraction, long end, Army. Our next set of retractors I'll lay out here, and these have different names. They may be called malleable retractors. They may be called ribbon retractors. Malleable because they are in fact malleable, and then they can be bent and modified as you need it. They're also called ribbon retractors because if you look at it from the side, it actually kind of has a little wave to it. It looks like a ribbon. So depending on where you go, you may hear different references with regard to malleable retractors. Malleable or ribbon retractors can be used in a very versatile way. If you need to move tissues out of the way, you need to craft the retractor to stay out of your way but reach a certain depth or curve, the instrument can be modified so that it can be used. It can be used in the pelvis. It can be used around the liver. It is a very versatile retractor. Probably the most common utilization of this retractor is at the time of abdominal closure. So open abdominal laparotomy incision. Essentially, what we're doing is we are closing the fascia, but something has to keep the enteral contents from getting incorporated into the fascial closure. It is very common that we use this metal device, the malleable retractor, to interpose between the abdominal wall and the the underlying viscera. So generally, when we talk about this instrumentation, it is, and we're talking about closure. It would only follow as human beings that every once in a while, as we're closing the fascia, one of these gets left behind. And in fact, one of the anecdotes I like to share with our students in multiple fold. One, emphasizing the importance of instrument counts. Remember that ultimately, as a surgeon, you depend on your team to help you, but you're responsible for the instruments that go in and out of the body. So ensuring that you have an accurate sponge and needle count and instrument count is absolutely essential. As bothersome as it may be, as cumbersome as counting and recounting may be, it is an essential part of the safety of the case. Number one. Number two, I'd like to share an anecdote with regard to these malleable retractors. So, at a local airport, a patient about 6 to 8 weeks out from his colectomy for cancer was traveling and set off a metal detector. A well-publicized plain X-ray demonstrated a malleable retractor in the midline. Patient was doing okay, but felt like his belly was a little stiff, but otherwise had recovered well from the surgery. Obviously not what he had planned on having. Was this retained retractor. Went back to the hospital where he had the surgery. Was then counseled and taken back to surgery by the surgeon who performed his initial operation. The retractor was removed. The abdominal wall was closed. Sponge and needle counts were correct. And I can tell you what's everybody thinking. Everybody's thinking is, how much did that patient receive in a settlement payment from the hospital? And the answer to that question is zero. And so the question, well, why? Why is that? Well, the important part of that is the lessons we learned around that story. Number one is the surgeon humbly came to the patient and admitted made a mistake. We left the instrument behind. But probably more importantly was the surgeon knew the patient, knew what he did for a living, knew his wife's first name, established a relationship with the patient, cured him of his cancer, and had a human-to-human relationship with the patient. Yes, he was a surgeon. Yes, he was a human being. Yes, he made a mistake. But because he had a human relationship with his patient, there was that understanding. There was an understanding, and they fixed the problem, and everybody moved on from that problem. And we really got out of the business of lawsuits and settlements and other things simply by having a personal relationship with your patient. So, what's the lesson, and how do malleable retractors connect to that? In the end, even as surgeons, where we do a lot of technical work, it remains a human profession and about human interaction with other human beings. Do we make mistakes? Absolutely, we all do. How we deal with the people that we take care of, and how we address those mistakes is really what makes us the surgeons that we are. All right, so moving on to deeper retraction. So when we come down and operating into the deeper aspects of the abdomen, these curved retractors are called Deaver retractors. Notice the curve and varying widths of those retractors. So it's a wide Deaver, kind of a medium Deaver, and then a narrow Deaver retractor. Frequently, these retractors come in handy, especially if the patient's in a lithotomy position. They can be positioned in the pelvis to retract the bladder. They can retract pelvic sidewall structures, essentially allowing for deep pelvic exposure. They can also be used for foregut surgery, especially to expose the diaphragm. The curve allows you to toe in and be able to retract structures, with the handle being long enough that the rest of the instrument stays out of the surgical field, yet provides exposure for the primary surgeon. So two retractors that medical students will spend a lot of time and get very, very familiar with are these retractors are called Richardson retractors. You'll notice that the Richardson retractors, this is a large Richardson retractor with a large end here, a more medium end here, to be able to give you the flexibility to use it on varying body types and or depths. There are body wall retractors, and body wall retractors are essentially one side with a gripping handle on the end. So recognize that people can call it Richardson, they may call it a body wall retractor. In either case, the eponym is apt. So we generally apply one face of the retractor. We retract the body wall, and that may be in the setting of retracting skin and subcutaneous tissue, or full thickness of the abdominal wall to expose a quadrant or a pericardial gutter or the like. So these are long or large Richardson retractors. If they're large Richardsons, there must be small Richardsons. So these are small Richardson retractors. Notice the difference in the depth of the retraction. And so obviously we'll utilize, depending on the patient's body habitus, depending on the exposure and the anatomic part being exposed, you would use the appropriate depth retractor. So sometimes we'll find ourselves using Richardson retractors for hernia repairs, even breast biopsies, depending on the depth of the incision or the depth of the lesion. So these are, once again, Richardson retractors. If it's a handle variant, it is a body.